I'm Susan Hawk. I'm 55 years old. I live in Huntington Beach, California, America. When I was told that I needed a hip replacement, I did a lot of research on the internet. My husband and I were not able to buy health insurance in the States, which meant that if I paid for a hip operation in California, I'd be spending $50,000 to $60,000, and we knew that wasn't something we could afford. So we started looking into medical tourism and found out about India right away. India seemed to be the best place in the world to go for world-class doctors. Once we had settled on India, we wanted to look at hospitals that had particular international accreditation, and Wockhardt came up, and we were very impressed, and we knew that we wanted to come here. I would say the medical team is world class. I'm 2 weeks today from my surgery. I'm able to walk. I have pain that is very tolerable. They took the sutures out today, and I will have a scar that will be like a pencil line, perhaps 6 inches long. And I'm quite convinced if I had done this anywhere else, I'd have a scar down to my knee, and I would not be in such good shape now. So I've been extremely impressed with the world caliber status of the doctors and their medical expertise. The physiotherapy started very soon and gradually built me up so that while the hip was healing, the other muscles around the hip that support it and give me strength had really atrophied. So the whole goal was to get me not just moving and mobile, but to build muscles that had wasted away in the months that I've been waiting for the operation. So they've been working with me since perhaps 2 days after the operation until today, and I can now walk with the cane. I can stand on my own. I feel much stronger. I just can't say enough about Sam and Sally. They have been fantastic. In addition to looking after me, my husband hurt his back doing all of the luggage and all of the things to get us here that I was not able to do. And so this same team was able to take care of him and look after him, do some assessments and some e-stimulation on his back. So we've just been extremely grateful to be here and to be in the hands of such great folks. I've had other surgeries in the United States. I had some bunions done on my feet, and I had a hysterectomy. So I have had surgeries in America. I've never had 12 doctors coming in to check on me every single day. I've never had 2 physical therapists in the hospital coming to see me and help me train and exercise and get better twice a day, every single day. And I have no idea how many nurses there are here. There are so many nurses taking care of me. I sometimes think they don't let them ever go home. They must be here 24 hours a day taking care of me. So that's really the most dramatic difference for me, the amount of care and attention, in addition to, of course, the cost. The cost is really about $10,000 here. It would have been $50,000 or $60,000 in the United States. The first most important part is that it's a little bit anxious to fly 30 hours to a country where you don't speak the language and just put yourself in someone's hands and say, can you get me to the hospital? And will this all be okay? And be confident that you'll be able to speak to people and well looked after. And that went away at the airport. Really, the minute we got there and got through customs and immigration, there was someone to pick us up, put us in a special car, bring us here, and then ever after that we were in the hands of people, all of whom spoke English in varying degrees. So that level of anxiety went away, and my confidence was fine about all of that. And I was absolutely impressed with the medical team and how professional they are and how competent they are. I really could not have got better care anywhere else, and would not have wound up with really a scar that's minimally invasive and a small resurfacing. So that's been fabulous for me, and I'm so grateful that the opportunity is here. I don't know how we would have got this done without insurance and in the States. I want to make sure I add a special note about the nurses. So the first thing to understand is that in the United States, if you push your call button for a nurse, you can wait 20 minutes. And it may be 1 or 2 nurses that you see routinely. You never get as quick a response as there is here, and you never get the numbers of people as there are here to take care of you, to answer your call, to help with your pain, to bring you a pillow, to adjust something. I have been just overwhelmed. If I knew someone that didn't have insurance and was facing a very expensive operation in the United States, I would absolutely tell them to come here. I trust that they would get world-class level of care, medical expertise and surgery, in addition to being looked after afterwards. It's a long way to come. You probably would not do that if you had insurance that would cover it all in the United States, but many people don't have that now. And even what you've got to pay, even if insurance covers part of it, is not going to take care of you. So I would absolutely recommend this to someone.